Anna.
Nice to see you again.
Yes, you too.
How did you get on?
Yeah, all right actually, you're right. It wasn't as bad as I thought it was going to be.
See?
So, I got the consent form, and actually because she was 12, I explained it to her and she filled in it, as well as her mum, and that was fine. They did have a few questions about where the data would go and who would see it. But actually the consent form was really helpful in answering those questions.
It was good that they could share that anxiety with you as well. It
Yeah.
shows they really understood and that they, you've already got a relationship going.
Yeah, yeah. And then I got them, both mum and the 12-year-old, to fill in the strengths and difficulties questionnaire and the ARCADS questionnaire.
Have you had a chance to score them?
I have had a chance to score.
Wow, okay.
Yes.
That's impressive.
Yes. So,
Was it difficult scoring them?
No, I put them on the Excel spreadsheet and the SDQ spreadsheet, and it was fine, and it came out with my graph, which I can show you. So.
Wow. Yeah. Okay. So how do you interpret those results?
So, well, in this case, I'm sure it's not always like this, but it was quite interesting because both mum and the 12-year-old had similar views, and she came up as on the SDQ as scoring highly for emotional problems and some peer relationship problems, and on the ARCADS she was above clinical cutoff for separation anxiety and panic. So that's all great and that's helpful. But
you weren't surprised by any of that? That sort of fitted your impression of them?
It did, and it fitted with what their main concerns were. But I just don't know what to do now, Emma.
Okay.
I have no idea which of this huge folder of questionnaires to complete now.
Well, it is quite overwhelming, isn't it?
It feels it, but I know that you're going to help me, so.
That's what I'm here for. So, you've scored your ARCADS there, beautiful graph, and you can see that it's higher for separation and for panic.
Yeah.
And you feel that kind of goes along with the family's explanation of the problem.
It does. The thing that she complains about most are having these what sound like sort of quite panicky attacks.
Yeah.
That usually happen at school, but sort of breathing goes, feels very dizzy.
Quite classic presentation.
Quite classic,
yeah. So, and maybe some of the separation anxiety is sort of safety behaviour because she's worried about this panic. Would that be a formation?
Yeah, I think that's probably right.
So, if we look at this that I just happened to have ready for you, when you score your ARCADS, if you see a child has got a above clinical cutoff for any one of the subscales, there's a symptom checklist to go along with that. So in this case, because it all seems to fit with the clinical presentation, you could use the panic one or you could use the separation one. They've both got sort of slightly different questions. You could use both, but that might feel like a bit much.
Okay.
So if you see, these are all the items of the ARCADS that relate to panic.
Okay, great. So they're all the symptoms of panic that I could be tracking.
And she would get us, if you use that as your session by session measure, you could score each session, plot it on a graph and see whether the symptoms are getting more or less, and see how she's getting on.
That sounds great. And it would be okay just to get her to do that?
I think you could choose. I mean, it sounds like she and Mum have got a similar position on what the problems are. So I think it's up to you.
So Mum and her could both do them, or
if they wanted to. I would think that as a minimum the child should be doing it, and if Mum and daughter think it's a good idea for them both to do it, then they could do that as well. Okay,
brilliant. So I have to do that every session?
Not every session. Basically, the main role of doing your symptom monitoring is to see how she's progressing. So if you have a session with her and it just doesn't feel like there's space to do it, or it feels clinically inappropriate to do it, then you don't have to do it that session, but so long as you're using it fairly regularly.
Okay, so this is, let me get this right, this is what's called the routine outcome monitoring.
Yes, that's right.
So using it. Okay, that makes sense. Okay, great. And if, I was just thinking about another case that I worked with in the past where nothing seemed to fit in terms of, there wasn't a clear sort of, I suppose, diagnosis or identified problem really that would fit into any of the routine outcome measures like panic or separation anxiety or depression, what would I use then?
Well, in the resource pack, there are a lot of other measures that aren't part of the symptom tracking for the RCAD, so they're not just for anxiety, depression. And so for each case, on a case-by-case basis, it's worth going back to the resource pack, having a look through the session-by-session measures and seeing if there's one that might be particularly useful for you on that case. I'm thinking of, for example, where you've been doing parenting work and the child's presenting with behavioural problems.
Yeah.
There's a session-by-session measure that looks at like conduct disorder type presentation. Family therapy, there's the score which looks at family relationships and difficulties in that. So, you know, they might not fit neatly into an anxiety or depression psychiatric diagnosis, but that some change might get picked up by one of those. If you really do feel like there's no kind of diagnostic category that you could put them in, there are various things you could do. You could use the impact tracking.
Oh, the impact tracking, what's that then?
Well, it's funny you should ask. It's, you know the back of the SDQ?
Yeah.
Basically, it's that.
Oh, right,
it says, since you've been last time, have your problems got better or worse? What's the impact, family, home, blah, blah, blah. Do you think they're going to get better in the future? It's a very brief form. It's very easy to fill in.
But much more general.
Might not be so sensitive to change, so it might not be quite so useful.
Right.
But it's a good alternative to measure broad problems. The other ones that families seem to quite like are the awes and caws.
Awes and caws?
Did you not see them yet?
Tell me what they are.
It's the outcome rating scale and the child outcome rating scale.
Okay. Are they the ones with the smiley faces?
That's the child outcome rating scale. Yeah, yes. So there's like an analogue, good, bad. So the ones for older kids and for parents says is verbal, and then there's a visual one with happy and sad faces for your emotions.
Okay.
And it looks at different domains of functioning, interpersonal, work, school, etc., and asks people since last time, where they would rate themselves along the line in relation to each of those domains. So really, what that's looking at instead of symptoms is functioning, how well the child is functioning. So that might be a better measure in the sort of case you're talking about.
Okay. So they would be my monitoring forms. Is there anything else that I could do? Because I'd heard something about goals and something about measuring therapeutic alliance.
Yeah, I think the goals are really useful because they're identified by the client.
Great.
So you can identify as many goals as you like. I probably wouldn't do more than 3.
Okay.
You have to be careful with goals though, because if they're too vague, it can become very difficult to manage. So make sure they're very concrete, very observable. So with your panic child, one of her goals might be to have less panic attacks at school.
Okay.
In which case you need to make sure you know how many panic attacks she's having at school to start off with, so that you can actually physically count them.
Okay.
Or to be attending school more days. Do you know what I mean? So it's something that you can really get a hold of and really try and measure.
And do you rate them on a scale of 0 to 10?
You get the parents can do this as well.
Yeah.
And the parents can even identify goals if they want to. And each session you ask them to identify on a 0 to 10 scale.
Okay, great. Okay.
And the other thing you mentioned was session feedback, I think, therapeutic alliance.
Right.
Yeah. So some people have been getting kind of nervous about this one, and it can feel a bit uncomfortable to do for the first time. But people tend to say once they've done it a couple of times, they find it really, really useful.
Okay. And that's the one where they just ask, did you feel listened to, has it been helpful?
There are a couple of different forms of session feedback, and there is one in the name of it eludes me at the moment, but it's more suitable for younger children. Session feedback form, and and it asks them that, and it's an opportunity for you to really examine the therapeutic alliance, and for them to tell you, actually, no, we need to be focusing more on this or whatever, and you tailor your approach in relation to how they're.
That sounds like it'd be really useful to know whether you're what you're doing is helpful.
And it sends them a message as well that you're open to hear that stuff, you know.
Okay.
Again, that's not something you have to do every session.
Okay.
Otherwise, you're just going to be giving them measures all session,
All
aren't you?
sessions. Okay. Okay. Well, that's really helpful.
Didn't you mention you were just about to close a case?
Well, not yet, but I know you're going on leave for 6 months. So I think by the time you come back from leave, I will have closed the case.
Right.
What do I do when I close the case, or if it's still open at 6 months?
Well, if it's still open at 6 months, I'd probably recommend a review.
Okay, sure. And what measures would I use at the review, or if I'm closing?
It's basically the same that you would use at assessment. It's that easy, Claire.
So the strengths and difficulties questionnaire.
Well remembered.
The revised child anxiety and depression scale.
Yes.
And then wasn't there something else?
I would be updating the current view form probably at that stage as well.
The current view form.
You can update that at any time.
Okay. And the CHI-ESC?
If it's a review, you don't need to do that. It's only the CHI-ESC that you need to do when you're closing a case.
Okay.
So if you're closing it, that's your service user feedback form. That's when they tell you how useful they found the service, how accessible they found it, whether they would recommend it to someone else, etc.
Okay. Well, that all seems to make sense. So just to double check I've got this. So I know at the assessment, with the patients, with the family, I did the SDQ and the RCADs if they're over 8 and get consent. And then from the RCADs...
Oh, hang on, what do you need to be doing at assessment?
Oh yes, I need to do the current view, the demographics and an events form. But I do an event form every time I see them, even if they don't attend. Okay. And then when I see them in each session, I will decide which of the routine outcome measures I will use to track the symptoms. So, for example, with my 12-year-old girl, we decided I'd use panic. But I could also use the ORS.
You could,
Or I could use the back of the SDQ, the impact measure. Okay, that's great. And I could also set goals. And I could also do the feedback form about how the session was going. And then at the end of all the work, I do the strengths and difficulties questionnaire and the RCADs again, and I do the CHI-ESC. So
you might want to update the current view form.
And update the current view form.
At any point.
At any point. Great.
But the minimum, every session you should be doing, the minimum is the events form.
Okay.
Even if you don't give any ROM.
Fine.
Or even the events form plus a symptom.
Brilliant. Thanks, Emma. That's really clear.
Yeah, no problem.
Thank you.
Anytime.
No
See you in 6 months.
Enjoy your break.